next speaker, let me tell you a little story before I get into this. Before I got to speak to this next person, I almost peed on myself. Like I'm like, Jesus God, please do it. Anyhow you're going to help me, please help me, because we need someone who is going to cover this topic. And I've seen this person work and know how amazing they are. I'm like, God, I definitely do need some of this specialty to speak to our audience and, get them fired up, get them inspired, get them learning something, one or two about their health. And when I met this person at work, I was like, okay, hello, can I speak to you for a minute? Can I speak to you? Oh, yeah, okay, what's up? Yeah, that's fine. I'm like, I have this event I'm planning, and it's going to be, I didn't go that way, like, we have this event coming up on the 11th of June. You have to prop yourself, like, we have this event coming up on the 11th of June, and it's about health and wellness, and I would really love you to speak. Is that okay? Okay, yeah, take a picture of my badge and email me, okay? Email me. And I sat like, I threw out the shit and like, oh God, what am I going to say to this person? How do I start this email? Somehow I got around to starting the email the person, and it was like a few hours later, and I was like, oh yeah, I'm definitely sure, I'm happy to help. Huh? No? I was like, oh God, the way I screamed, I'm sure that my neighbor somewhere with what the heck is going on with that girl? Anyways, without further ado, I'm going to introduce this special person. So this person is an experienced healthcare professional with a strong background in intensive care medicine. This person has worked at several reputable hospitals and healthcare institutions, including GSTT and Cairo University Hospital. This is no other person, right, than Dr. Ibrahim Salama. Let's welcome him.
Thank you, everyone. Thank you. I'm very delighted to be here with you. And thanks, Esther, for this great introduction. Thank you. Yeah.
Where is Dear John? Dear John? Dear John.
Okay, hello everyone. Good afternoon. My name is Ibrahim Salama. I'm just moved in from Egypt to here last year. I started recently here in GCC Hospital. I'm working in Egypt in Cairo University Hospital in Cardiac Center, which dealing mostly with the acute cardiac events for 7 years. Acute cardiac events including heart attacks, patients coming with arrhythmias, palpitation, fast heart rate, and all of these acute situations. As we understand, intensive care is not a pleasant place for anyone, even for the doctors who used to work there. It's a very scary station, very scary environment, and if you spoke with anyone who been in intensive care previously, he will say how scary he is, how he feel he would be, how scary he is, and how he felt during this experience. And during the last 7 years, I have this question I used to ask to my patient at the end of their journey with us when they go on home and they are full of health, and ask them, how did you feel after all of this? And I usually get the same answer from every patient. They usually start crying, and then they hold their tears and start to say, I felt I was one step away from death. Usually the same answer, one step away from death. I don't understand what happened. I don't understand how ended I would be here in the ICU. I can't tell you what I was thinking about, because I felt I totally dissociated from everyone around me. I totally dissociated from anything. I can't understand anything. Just I was one step away from death. Sorry, it's a bad story, but this is our life in ICU with our patients every day. But here, we will discuss cardiovascular disease in the BAME community mainly. And I know this is not a lovely topic for everyone, try to avoid it, but let's break the silence here and speak with the cardiovascular disease. First of all, a small introduction to our lovely BAME group, people who came from all over the world here to UK, which including one of me also. So our BAME group including the Asian, Africans, and the ethnic minority groups. Yes, yeah. So they are very, very diverse in the language, the culture, and their backgrounds, which is is important to take in mind when you're treating these patients. And the migrations of people to UK started in the 17th century, basically, and a big jump happened in the 19th century, especially at the middle, when it came from India, Pakistan, Bangladesh, and even from Africa. But we all heard about the positive contribution of the BAME community in the UK societies. There's a very small examples from people came from other culture and made a great contribution to UK society. Everyone know Mo Farah? Yes. Mo Farah, he's born mostly in Somalia, and he's won multiple Olympic gold medals for the UK. And I'm sure everyone is aware from Suella Braverman and Rishi Sunak, the current Prime Minister of UK, which are both of them born in UK and India originally. So, what are the challenges faced by the BAME community? Mainly is the language, discriminations, cultural differences, and racism, prejudice, and health illiteracy. Health illiteracy is the most important here in our topic. These challenges make it very difficult for everyone who came recently to UK to integrate in society. And at some point, he might feel the social isolation. By the way, I felt this when I came in here, and my first 3 months, I just giving you my experience. My first 3 months, I have a language barrier. Despite I was studying in English, but the British accent was difficult to me when I came in here. And I felt it's very difficult to me. The system is new, the culture is new, everything is new. And even the start date of the walking is different. We used in Egypt to start, the intensive care usually starts at 10 a.m., which is, but yet you have to wake up at 6, which is different from me. In the Middle East, we like the nightlife. Here, there is no nightlife at all. You have to wake up earlier and go to bed earlier because you have to work the next day morning earlier. So it was completely a mess to me in the first 3 months. But with time, I get to use it. I made friends. I go out with my friends, so it's much more easier now. So what's meant by cardiovascular disease? Cardiovascular disease is any disease which affects our heart and the blood vessel. So it's literally the whole body. Yes, your brain containing blood vessels, your arms containing blood vessels, your tummy containing blood vessels. So it's literally everywhere. And according to the WHO, cardiovascular disease is the leading cause between all kinds of diseases of death in all communities, not only the BAME groups. The conditions, so this disease can cause many diseases, starting with stroke, heart attack, arrhythmias, peripheral vascular diseases, and of course, death. So the prevalence of cardiovascular disease is, according to the British Heart Foundation in 2017, 14% of adults have a cardiovascular disease. 15% men and 13% of women have been diagnosed with a cardiovascular disease. Afro-Caribbean populations have more common cardiovascular disease because are more genetically predisposed for this, 3 times more than the white people. And South Asian people are also more risk for developing cardiovascular disease because they have a 6 times incidence of having diabetes and hypercholesteremia than the white people. Here we can say the prevalence of cardiovascular disease in the black population. As I said, black people are more likely to develop cardiovascular disease 3 times than the normal white people because of their combination of genetic and environmental and lifestyle. For example, sickle cell disease. Anyone is aware of this, sickle cell disease? Okay, so our normal red cells is like this, oval. But in sickle cell disease, it becomes S-shaped, double-hooked, like this. So what's happened? One of these presentation of sickle cell disease is your red blood cells stick together and go to block small arteries and cause blockage of the blood flow, which causes ischemia and decrease in the oxygenation. One of them are very, very popular in black people rather than the white people. And this is all genetic. And also, the black people are well known to have a hypertension, diabetes, and obesity. In the Asian population, as I said previously, they have a higher incidence of diabetes 6 times. And as a doctor, diabetes is the most important risk factor for cardiovascular disease. So the Asians are very known with their special diet habits. Yes. They like saturated fats, they like sugar more than anything else. I know they like fruits and vegetables, but not as they like sugar and fats. And they are well known for heavy smoking and alcohol use. So all of these factors can increase the risk of cardiovascular disease. As we said, these are the most common factors. Some of them we can change, and some of them we cannot change. Smoking is coming on the top of the list. Stress. Our stressful life these days are more and more stressed than before. Alcohol, high blood pressure, and hypercholesterolemia in our blood, high level of lipid. Sedentary life, going to work in the early morning, back at the evening, you just eat and go to sleep, and so on. We have only 2 or 3 days in the weekend, and we all feel like tired. I need to sleep. I need to just sit on the couch for the rest of the week to have a good spirit for the next week, and that's it. And the things we cannot change is the family history of heart disease, your genetic, your code, your DNA. That's the thing medicine haven't found any solution for this yet, and your ethnic backgrounds. These things we cannot change. Lifestyle. I'm trying to make a pictures for every of the slides to make it simple as much as I can. Lifestyle, as we start with physical inactivity. How physical inactivity can be a risk factor. How being comfortable on the couch is a risk factor of increasing my blood pressure. This is very important, yes. So being on the couch most of the day, as we all do, is decrease your metabolism. Literally, decrease your metabolism, increase your level of lipid in your blood. And with this, your blood become more thick, increase the viscosity, with this at the end cause high blood pressure. Unhealthy diet, eating too much saturated fat, too much sugar, at the same time increasing the glucose level in your blood. And where this all glucose go? At the end, it turns to lipid and stored in your body. Tobacco use. As we all know, our blood vessels are a cylinder like this. And with this cylinder, we have the inner layer, which is a very, very tiny layer, but it's very, very important. It's very smooth, so it can maintain the blood flow. Any cracks or anything in this layer can predispose a problem, actually a big problem. This is where the heart attack and all of the strokes and the ischemia start. Smoking causes these cracks in your blood vessels. So when these cracks happen, the clots start to form, and then ending with stroke or heart attack. And here is a little demonstration. Sorry. I missed this. Is it getting you? Yeah. Oh, sorry. Okay, this was literally a video, 40 seconds, demonstrating how blood vessel or how the stroke or cardiac attack happens. So as we see here, this is our blood vessel, and this is the inner layer of our blood vessel, and here this is the lipid that's happening in our bloods. So when the lipids level increase in our blood, what happened? It starts to be stored under this small layer, and when it starts to be stored, literally, this is the layer. This is our blood vessel layers here, and then the blood. Let's take this as the lipid. So the lipid is stored here under the layer and start to make a curve here. So with time, this curve starts to narrowing your blood vessel, so on, and ended with closing the blood vessel completely, which impaired the blood flow and ending with stroke or heart attack. So how we address this disparities in cardiovascular preventions? To address this, you need to understand what you're targeting, which group you're targeting. So you need to understand the culture, you need to understand the ethnic background, you need to understand the linguistic barrier to just tailor a specific regime for these people to change their life. Let's start with how we prevent the things that can change our life. Here, intervention to prevent cardiovascular disease. As we said previously, there's some risk factor we can modify and other we can't modify. Thanks God, lifestyle is the most contributing factor of our health problem, and this can be modified. Healthier diet. What do you mean by healthier diet? Everyone knows this. to eat more fruits, to eat more vegetables, less sugar, less saturated fatty acids. What I'm saying here, I'm not here to give you what to eat and what not to eat, and how much to eat and how much not to eat. My message is, this is the most contributing factor of your health. This we can change. This we can control. So if a small contribution, small change in our lifestyle can make a big difference at the end. Healthier diet, reducing the amount of salt. Salt can be retained in our body. And what salt does, it just brings more water. And when you bring more water in your blood vessel, increase your pressure, and ending with high blood pressure. Decreasing your alcohol consumption. Alcohol is very, very important. You need to decrease the level of alcohol consumption. Why? Because alcohol is just harm your liver. And what is the liver? Liver is the main organ responsible for clearing of the toxins from the body, and it's storage and the factory of the lipid. So when you destruct your lipid factory, what happens? The lipid stays in your blood and ending with more cholesterol, high cholesterol, and all of this become predisposed in your blood vessel and causing more damage. Being physically active. Here I said at least 150 minutes of moderate intensity per week. It's okay, this is a recommendation, but at least walking every day, go to walk, walking, minimal effort every day for 30 minutes, just walking will change your life, will make a big contribution. And of course, stop smoking. Stop harming your blood vessels. Stop injuring your blood vessels. And here, there's a lot of services, maybe not anyone aware of it, but if you have national insurance number and the GP registration, you can use all of these services. This is a free service. Everyone of us can use it and can help him. Stop smoking services, weight management services, physical activity services, alcohol reduction services, and diabetes prevention. And I personally recommend if anyone has a family history of diabetes to go to the diabetes prevention program. This is the most important. You might not prevent diabetes to come to you, but at least you can delay it. And we all know as a healthcare practitioners, diabetes complications depend on the duration if you're having diabetes. If you're having diabetes for 10 years, you will be exposed to more complications than if you're having diabetes for 2 years. At the end, the community contribution, our organization and health ministry, this is what we need in our community. We need more organizations, more community organizations to help increase the awareness of the people and the community, to educate the people what they need, because not all of us are aware of the services we have, not all of us are aware what we need to do. So this is very important. Knowledge is power, but the ultimate power is what you do with the knowledge you got. Thanks everyone. Thank you.
Thank you, doctor.
Oh my God! Thank you so much, Doctor. You see, it was worth it, isn't it? It was worth me having the bum tingling and still reaching out to him. So it was awesome. I think I could have taken a screenshot of where when he talked about the Asian community. I had somebody next to me who was really cracking up. She was like, yeah, I did that. Yes, I know it. I've been taking too much of those things that you were talking about. And I was like, okay. Like you could, this cardiovascular illness, look, we actually looking after our heart. And when he said it goes into it's not even just your heart, it's your stomach. Like you have, this light is too bright on my eyes. It goes that we have this blood vessel everywhere, and it's the leading cause of illnesses. So the question is, how are we going to look after our heart? How are we looking after our cardiovascular health? Are you able to find it? Yeah. So, thank you, Doctor, for that lovely presentation. Okay, so moving on now, we're going to move swiftly. I'm happy we're in good time. Thank you everyone that is joining us. I can see some new people in. Thank you for coming.